Here's my take. Many liberals now believe that the Affordable Care Act, sometimes called Obamacare, is unpopular only because most Americans don't understand it. There's some truth to this. Studies show that the core provisions of the bill are more popular than the bill itself. But there's also a reason, rooted in reality, why many Americans worry about Obamacare: its cost. Remember, most Americans have health care. What they worry about is the cost of insuring 20 million to 30 million more people. And unless the meteoric rise of healthcare costs is slowed, a big expansion of coverage might well remain unpopular, no matter how it is explained. Now, how is that going to happen? Well, Republican alternatives to Obamacare, such as they are, do have a strategy to control costs: get consumers to pay more for their health care. The basic idea is intuitively appealing. Markets produce efficiencies. They presumably would do the same thing in healthcare. But the situation on the ground suggests that markets work imperfectly in this realm. A new study conducted by the pharmaceutical company Novartis and McKinsey & Company shows a stunning difference among countries with regard to healthcare efficiency. For example, smoking rates are higher in France than in the United States, so the French population has higher rates of lung disease. Yet, the French system is able to treat the disease far more effectively than happens in the United States. Its levels of severity and fatality are 3 times lower than in this country. And yet, France spends 8 times less on treatments per person than the US system. 8 times less. Or consider Britain, which handles diabetes far more effectively than the US, while spending less than half of what we spend per person. The study concludes that the British system is 5 times more productive in managing diabetes than the United States is. To understand this issue better, I spoke with Daniel Vasella, the chairman and former chief executive of Novartis and a physician by training. He's also frankly pro-market and pro-American, both of which have occasionally made him a target for some criticism in Europe. Vasella emphasized that there's no single model that works best, but he explained that France and Britain have been better at tackling diabetes and lung disease because they take a system-wide approach that gives all healthcare providers an incentive to focus on early detection and cost-effective treatments that make wellness the goal. So I asked him, is the lesson that only the government can produce system-wide improvements? Vasella's brief answer is yes, this is a case where you need government action. You see, economists have often written about the asymmetry of information, areas where consumers are not expert enough to be able to determine what product is best. Evidence increasingly shows that this is true for health. After all, consumers freely make the choice to smoke, eat junk food, and forego preventive care, all of which are highly likely to make them sick, force up their healthcare costs, and lower their quality of life. Having us spend more of the money ourselves is not likely to solve the cost crisis in healthcare. Let's get started.